For about over 20 years now, I've been living at this really fascinating intersection of medicine and media. And I think for me, it's one of the best jobs in the world. I get to continue to practice neurosurgery, as Michael mentioned, which is probably my first and still my truest love professionally. But I also get to travel the world, many places in the global south, telling the stories of people, oftentimes at their best, sometimes at their worst, but always with so much to share. So I get to be this perpetual student, while at the same time being a storyteller and a teacher as well. And what I realize about them is that they're both very human professions. They're really human professions. They're professions in search of a type of AI, which is authentic intelligence, even more than artificial intelligence. So hopefully these are jobs that are going to be spared by all the changes that are happening. But I can tell you this as well. Sometimes the dance between medicine and media can be a challenging one. It can be an awkward dance. It can be emotionally difficult. But the reason we do it, I think, for most of us, is that we feel the stories almost always lead to something. There's some tangible that comes out of it. They may lead to our viewers being more curious, more connected, more compassionate, perhaps even more compelled in some ways to do something, to say something, to see something a little bit differently. And I think it's why I've continued to work in this area as long as I have. As I mentioned, I did not set out to be a television person. And frankly, I'm a little suspicious of people who do set out to be television people. It's kind of like the little kid who tells you they want to be a politician when they grow up. Kind of freaks you out a little bit, the idea. But over the years, I wrote for various magazines, and I was always sort of interested in our healthcare system. We're a system that spends $4 trillion a year on healthcare, and I often just wondered, what do we really have to show for it? We obviously are serious about it. We place a lot of value in it. But what do we have to show for it? It fascinated me then. It fascinates me now. My interest specifically was looking at other healthcare systems around the world and saying, hey, look, what can we learn from that other healthcare system? Are there things we could learn from them that we could apply to our own system? Eventually, that work took me to more writing. I worked in the White House. I was primarily writing speeches on the topic, learned a lot about medical messaging, and then ultimately thought I might continue that sort of work, talking about healthcare policy specifically in the world of journalism. I thought I was going to be sort of a policy wonk kind of person, That was my background. So for me, I started at CNN in August of 2001, thinking I was going to talk about healthcare policy at that time and all that was changing in the world. And then 3 weeks after I started, 9/11 happened. And all of a sudden, I was the only doctor working at an international news network in the middle of this terrible tragedy. And they said, look, we're probably not going to be talking about health policy for a while. Do you want to talk about some of the other things that are happening? And I soon found myself standing outside these hospitals in New York with these armies of people in blue and green, nurses and doctors, waiting for patients to come in from the tragedy. And as you may know, so few patients ever came because people either lived or they died. There wasn't a lot of people caught in between. It was the first time I remember sort of the parallels between medicine and media. I remember these family members of the deceased would come up to you at your live shot location, and they had these placards with pictures of their loved ones, and they wanted you to, they wanted to show the placards on television. And they were begging you to do that because somehow they were still convinced days, even weeks later, that their husband or their wife or their son or their daughter was still alive, but just lost. Really tough position to be in. And I remember thinking in medicine as well as in media, you continuously have these reminders of the value of hope and optimism. How do you objectify the value of hope? How do you objectify the value of optimism? It's not easy to do, and it's a tough balance to strike. I mean, if you think about your own lives, even with your kids or your parents or your friends, In some ways, we are constantly balancing this inflection between hope and honesty. Some balance it more in one direction than the other. And even as a scientist myself, a data-driven guy, I find that there is always this balance, even for me, between hope and honesty. And where I come down on it, and it's a little bit of what I wanted to talk about today, some of the things that I've seen around the world, where I come down on it is that I get reminded over and over again that hope in and of itself has an intrinsic value. And it should not be labeled as the opposite of honesty. Hope can help heal. And I think in the first story that I really ever did, that I ever covered, I was more the doctor than the reporter with that sort of sensibility.